Yes, hi. I have pretty bad osteoarthritis in both of my knees.
All right.
And my next, I've been through so many different things to try to relieve the pain, but my next thought was trying to get the gel injections, and I'm wondering...
Okay. All right. So what you're looking at is the product is called Synvisc. There are actually two of them.
Yes.
And what you do is that you're injecting a hyaluronic acid directly into the joint. Okay, generally you have to do several, usually 2, 3 or more injections. You space them out by a couple weeks. And does it work? Yeah, but how long does it work? Okay, it generally lasts about 6 months, sometimes as long as a year, but it really doesn't do that much for you. There are a bunch of other things that you can do that are less invasive, less likely to cause infection, and less likely to cause an allergic reaction for that matter. So generally speaking, okay, and I used to do those injections, into the knee. I thought they were wonderful until I realized that A, they weren't all that wonderful, B, they weren't all that inexpensive, and C, they weren't with all those risks, and started using transdermal anti-inflammatories. Okay, the ones I used to use was florbiprofen, ketoprofen, so on and so forth. But ketorolac, the 2% DMSO, works best of all. Why? Because it's cheaper. You can have the stuff on your insurance card. You have to argue with them a little bit. The one that I prefer is called Pensade. The one that I least prefer is called Voltaren Gel, but it's around and people know what it is. But when you use the gels, they have to be applied behind the knee, even though your pain is in the front. I don't care about where you feel it. I'm really more interested in how to get the medication into the joint to the appropriate areas. But there are some other things that you can do that will give you a good bit of relief. One of which is the glucosamine sulfate, not glucosamine hydrochloride, MSM, methylsulfonylurea orally, because it's best to use it topically. But then there's something else, okay? You can actually take hyaluronic acid orally, and it works beautifully for this. It's best to catch it before people are really limping around like crazy. But you can use hyaluronic acid capsules, the 100 milligram capsules. But if you're really frugal, okay, and I'm a kind of a frugal guy, what I do is I bought this stuff called Lubricin. And Lubricin is actually intended for horses. And it comes in these 1-quart jars for about $50. And what you do is you take a teaspoon of this, put it in your Wheaties, and you do it every morning. And what happens is you're cutting the cost per dosage by about 95%. Okay, because I'll tell you what, when you're giving this stuff to horses, okay, it gets to be ungodly expensive. But the Lubricin folks really have a decent product out. It's liquid, but you take 1 teaspoon once a day in your cereal. Okay, and you'll start feeling really, really well with this really, really quickly. So, Mary, give that a try. Let's see how you do and see if we can't avoid sticking your needles under fluoro with some interesting stuff.